Of the Chicago Tax Day Tea Party here in Chicago. He's been a leading healthcare policy team leader for the Illinois Tea Party and representing clients in group and individual consumer-driven healthcare and life insurance in over 15 states. And he's garnered a notable reputation in informing and navigating through the far-reaching complexities of comprehensive insurance coverage on behalf of families and small business. He truly is an expert on Obamacare and the Affordable Health Care Act. So I'd like to welcome him to the stage now. Thank you.
Hey, we're all still here. This is great. I want to thank you all for coming out. I just want to let you know a few little updates on the President's health care law. We now have two new legislative branches. You know, if you study the Constitution, you have the executive branch, the judicial branch, right? Well, we now have two new legislative branches, not Congress. The Internal Revenue Service is now a legislative branch, thanks to Obamacare. There are three different kinds of health insurance exchanges. We've all heard about the health insurance exchanges opening on October 1st. There's a state-based exchange where the governor and the legislator in that state says, hey, we love this law. Come on in. Everybody come on in. We're going to do a state-based health insurance exchange. Then we have what Illinois has done under Governor Quinn, which is a state-federal partnership exchange, where Governor Quinn said, hey, we're not going to be ready by October 1st, so you guys open it, and then when it's all open, we'll run it as a state. And then there is the option that 26 states have chosen, and that is a federal fallback exchange, where the governor says, we don't want anything to do with Obamacare. Don't come into our state. You know, like the states that surround Illinois. Missouri, Indiana, Wisconsin, but not Illinois. We're marching forward right off a cliff. So of these three different exchanges, in Section 1311 of the Obamacare legislation, it states that if you open a state-based exchange, we're going to empower the Internal Revenue Service to come in and be able to artificially lower the cost of health insurance. Anybody know what it'll cost a family in 2014 for health insurance in the exchange? $14,000 a year. $14,000 a year. By 2016, it's going to be up to $20,000 a year for a family. So, what the President has done is, under Section 1311 of the Obamacare legislation, he empowers the IRS to come in and artificially lower that health insurance premium. So for a family of four making $51,000 a year, which was the average income in 2012 for a family of four, that premium is going to be reduced by $10,800 a year. Do you know who's paying that? The few, the proud, the 51% of us left paying income taxes in this country. We are going to be lowering the premium artificially. And if you think these people are going to vote against that subsidy, we're talking 60 million people who will be eligible for advanced premium tax credits, courtesy of the few, the proud, the 51%. There's no way they're going to vote against that. So back to Section 1311. It empowers the IRS to provide these advanced premium tax credits. It also empowers the IRS to penalize any employer with 50 or more employees if they don't offer government-approved health insurance. How much? $2,000 per employee for every full-time employee from your 30th on up. Everybody's heard of that, right? Section 1321 is the section in the Obamacare legislation that outlines a state that has decided to push back and open no exchange. If that happens, Section 1321 empowers the U.S. government to come into that state and open an exchange whether you like it or not. So they usurp our 10th Amendment rights. That's the fallback exchange. That's described in Section 1321. In Section 1321, the IRS is given no power to provide any advanced premium tax credits or to penalize any employer in those states for not offering government-approved health insurance. So we've got now 26 states that do not have to comply. So what you're going to have is a huge flight of wagon pullers, taxpayers, moving to the states that don't have to abide, that are pushing back, and you're going to have the blue states like Illinois basically just crumbling upon itself because of the exchanges. So the Internal Revenue Service last year decided to write new law all by itself. Anyone ever heard of the Internal Revenue Service writing law without Congress? Here's what they did. Because these governors are pushing back, the IRS was empowered by Barack Obama and his administration to simply build a bridge between Section 1311 and 1321 so that every state that is pushed back and says we don't want an exchange, they empowered the IRS to not only provide premium tax credits, but to penalize all employers in those states too. Anybody heard of that? So the Internal Revenue Service is writing its own law. So the AG, Attorney General in Oklahoma, decided to sue the Internal Revenue Service for penalizing all of those employers in those 26 states. And according to the Kaiser Institute, which is left-leanings, they believe that's one of the most powerful lawsuits against the Obamacare legislation. So there's that. And then there's Medicaid. We've all heard some governors are going to be expanding Medicaid, some governors are not. In Illinois, they've decided to expand Medicaid blindly. So we're going to take everybody who's making 138% above the federal poverty level and give them free health care under Medicaid. So these are single adults now, 15 million of them without children, who are going to be getting free health care. The problem is they're going on Medicaid. Medicaid is the most dangerous health care system ever devised by man. The largest study of its kind was completed in 2009 by the University of Virginia. And they determined the survival rate of people who have surgery on Medicaid compared to people who have surgery with private health insurance. And the shocking results were that you're 97% more likely to die after surgery on Medicaid than you are with private health insurance. And this is before we put 17 million more people onto Medicaid under the president's health care law. So if we're going to be expanding Medicaid in Illinois, what we need to do is what Governor Daniels did in Indiana when he reformed the Medicaid system and developed a program called Healthy Indiana. And the same thing happened under Governor Rick Scott in Florida. Instead of piling people onto a dangerous, broken Medicaid system where doctors are not paid, right? Instead, provide them private health insurance plans so that they have the same dignity as anybody else does. Just because they're low income doesn't mean that they should be put on a broken, bankrupt system. So you provide for them private health insurance plans. If Illinois would have done that last year, they would have saved $1.1 billion in tax outlays by just piling people onto Medicaid. So that should be our answer as conservatives. We taxpayers provide all of the programs for the poor and the indigent. We do care about the poor. We're just asking that you spend those dollars better. Instead of piling everybody onto Medicaid, purchase private health insurance plans for them. And the same goes for Medicare. Before the election, everybody remembers when Paul Ryan had his plan to save Medicare, right? Well, it wasn't just Paul Ryan's plan. It was also Ron Wyden's plan. Who's Ron Wyden? Ron Wyden is a far-left Democrat from the state of Oregon who heads up an organization called the Gray Panthers. And they believe in a single-payer system. But they knew that that wasn't passable. So he got together with Paul Ryan and they developed a program to save Medicare. I've been sick for 4 days, sorry. And so here's what it would do. Instead of just extending Medicare, you have to understand that the CMS and the Chief Medicare Actuary stated in 2012, just last year, that Medicare will be paying out more than it's taking in by 2016. When you're paying out more than you're taking in, what is that? You're bankrupt, right? So the president's fix for that with his health care law was to simply cut $716 billion from our nation's Medicare program. And the way he did that was simply cut reimbursement ratios to doctors, hospitals, and home health care clinics. By cutting $716 billion, he extended Medicare to the year 2023. Paul Ryan and Ron Wyden said enough of the cuts. Cutting is not the answer. Introduce private health insurance plans to Medicare. That sounds radical. No, we did that with Part C, Medicare Advantage. That's all private health insurance plans. So what Ryan said was, in 10 years from today, if you qualify for Medicare 10 years from today, you'll have access to fee-for-service Medicare, if it's still there, but you'll also have the option to purchase private health insurance plans as a senior citizen. By doing just that change and letting my industry, the health insurance industry, get access to Medicare, Ryan and Mitt Romney, right before the election, said that they'll be able to restore every penny of the $716 billion that Barack Obama cut from Medicare. But it's not just the $716 billion. Over the next 20 years, according to the Chief Medicare Actuary, Mr. Richard Foster, This is President Obama's chief Medicare actuary. This health care law will cut $4.95 trillion from Medicare. Not million, not billion, trillion. It simply must be stopped if you care at all for our nation's seniors and you care at all for our nation's indigent. It must be stopped. And there are plenty of lawsuits still pending at the Supreme Court. The one was the one in Oklahoma from the AG there. But there's also companies now that are being forced to provide abortion pills, abortifacient drugs, which is against our First Amendment rights. Hobby Lobby is being fined $1.3 million a day by this administration because they're Christians and do not want their tax dollars paying for abortions. This is happening right here in the United States. And HHS's bill is writing horror novels every month and dumping it into the Federal Registry. They're changing the law fundamentally because they knew the way it was written, it was designed to fail. So pre-existing conditions. Remember when they passed the healthcare reform law under Mitt Romney in Massachusetts? They were allowing people to wait until they were sick, right? Then buy a health insurance plan. They were buying it in the emergency room, right? You get the plan, you keep it for as long as you need treatment, and then you get rid of it. Why would you keep it if you can get another one next month when you get sick? And that was causing the rapid bankruptcy of insurance companies in Massachusetts. It was also causing insurance companies to leave Massachusetts. So when Governor Devil Patrick took over, he said, enough. We are going to have an open enrollment period for all health insurance plans. It'll be just like Medicare. So this year, thanks to HHS, who finally woke up 2 years later, they've now adopted what Governor Devil Patrick did in Massachusetts. And you can no longer game the system. Starting October 1st, 2013, right here in Illinois, every American in Illinois, every American nationwide will be able to buy health insurance from any health insurance carrier in the nation without regard to pre-existing conditions. And you have from October 1st until March 31st to get into that open enrollment period. In 2015, it will become like Medicare. Starts 10/1, ends 12/31. But you will not be able to hop on and hop off the system. And there's one more thing I want to tell you before I close. President Barack Obama sold this legislation based on covering people with pre-existing conditions, right? I want you to know that as of March 5th, 2013, President Barack Obama is denying coverage to Americans with pre-existing conditions all over this country. Because his temporary pre-existing condition insurance plan that he spent $5 billion on, that the Centers for Medicare and Medicaid Services said was supposed to last from 2010 to 2014, ran out of money on March 5th. So I want everyone in America to know that President Barack Obama is denying coverage for Americans with pre-existing conditions all over this nation and will not be offering it again until 2014. For more information, visit truthaboutobamacare.com. Thank you.
I'd like to thank everyone for coming today. And also, please, before you leave, check out our tent at the back. Restore Our Principles is my student organization that's working to promote conservatism and civil political discourse in high schools and colleges across the country. Thank you for all coming.